Hi guys! Today I wanted to talk about diet, not necessarily losing weight, not necessarily different pet food manufacturers, but different diets that I'll utilize in the management and treatment of different disease conditions. The most common diseases that I see that I'll utilize diet are going to be gastrointestinal diseases, probably first and foremost. I also see different kidney diseases, so mostly chronic kidney diseases. I talk about diet, and then some liver diseases, but not all of them. When it comes to the gastrointestinal tract, typically the reason that I'm utilizing diet is for those patients that have inflammation, either due to dietary hypersensitivity, so that would be food allergies, or where they have inflammation in the gut from an autoimmune process, and that would be inflammatory bowel disease. Those patients in particular, the ones with inflammatory bowel disease, sort of like people with Crohn's, different diets can either intensify or help reduce some of the inflammation in the gut. And so often I'll utilize diet as a way of helping to manage those patients and reduce inflammation. When it comes to gastrointestinal diseases, I usually will pick from one of a few diets. The first grouping of diets would be novel protein diets. And basically what that means is picking a protein source that pet has never had before. And there's different diets on the market that will have things other than chicken, lamb, and beef, which tend to be some of the most implicated causes of food allergies in dogs. It's not that there's anything inherently wrong with those protein sources, it's just that they're so widely spread that a lot of pets have had exposure to one of those protein sources, and so I tend to try to avoid those. Now, each individual pet's going to be a bit different because for those pets, they may have been on a diet that had duck in it or that had, rabbit or something like that. And so we often have to go through their diet history really carefully so that we can identify what diet for that particular pet is going to be best. Usually what I'll look to, again, are going to be duck, rabbit, venison. We look at things like salmon, whitefish, there's an alligator diet. So there's all these different diets, and then there's also even some vegetarian diets as well, but those tend to be a little less palatable. Usually these grouping of diets, the novel protein diets, are often what I go to first because we do have some variety as far as flavors. There's different brands that I tend to go with, and I tend to go more with the veterinary exclusive lines just because I know that the access to my clients, they probably wouldn't have had exposure to those particular lines before. And then also quality control. All of those diets are actually going to be made on separate machines, or in some situations the whole plant is actually sterilized prior to making of these different diets, and so I know that there's not going to be any cross-contamination. The other thing that I know I'll get with some of the bigger companies is they're going to have an AFCO statement on the package, and that means that the diets have been formulated to meet certain criteria known to support, either maintenance, maintaining the body weight of an adult dog or adult cat, or going to be formulated to meet growth requirements. And these aren't things that are mandated, but these are things that I know, a nutritionist has been involved in making sure that these diets meet the general needs of the pet. So that's usually why I'm going to go with one of those. The other thing more recently that I think is a benefit of going with one of the veterinary exclusive diets is that these diets have not been implicated at this point in leading to dilated cardiomyopathy, which is something that we're starting to see with some of these boutique or exotic diets that are on the market. and we're still trying to work to figure out exactly what the problem is with some of these diets. But at this point, because a lot of the novel proteins are going to be grain-free, I want to make sure that I'm not going to put my patients in harm's way by, essentially feeding a diet for one purpose. I don't want to be causing another issue. So these veterinary exclusive diets like Hills and Purina and Royal Canin, I know and I can trust that if my client's going to go and buy these different diets, that we're treating what we think we are treating and that we're not causing a new issue. So putting novel protein diets aside, and again, I usually will go with one of those first because I find that palatability is really high with these diets and we have a lot of choices. The other grouping of diets that I'll go with in some of these patients with gut disease is actually hydrolyzed diet. And I find that I'm reaching more and more for hydrolyzed diets than I was in the past, but typically, personally, I only reach for them if we couldn't find a good novel protein diet to feed these pets. Then we go to something that's a little bit more restrictive. But as more data comes in, it actually seems that these diets may be better at reducing inflammation in some of these patients, that the palatability is going up, so they're more likely to want to eat it, and that they're a little bit better in being able to, rule in or rule out food allergies. So hydrolyzed diets basically are diets where the protein source has been broken up into individual amino acids or really small protein peptides. So they're kind of broken up using water to just little teeny itty bitty pieces. And what that does is that makes these proteins, these amino acids, too small to be recognized by the immune system as foreign. And so often we won't get a reaction by the immune system. The immune system won't go haywire when exposed to these different foods. So again, there's fewer of these diets on the market. They tend to utilize things like soy or chicken or different chicken products as the protein or amino acid source. So the variability and the diversity of different proteins are a lot lower with these foods. And so again, that's why in the past I probably haven't gone to them first, because there's always that risk that I try to feed a patient one of these diets and they don't want to eat it. But I think palatability is starting to come up. I'm finding that for a lot of patients, rather than trying to guess what novel protein might work for them, it does seem like some of the hydrolyzed diets have a higher chance of working to get different gastrointestinal issues under control. Again, I utilize diet often as part of the treatment, so not a sole treatment, but the caveat to that is food allergy. So there are some patients where it's just hypersensitivity. Once we find the right diet, they're golden. But in a lot of the patients that I see, diet is part of the treatment along with medications or other tools to get their gut under control. When it comes to chronic kidney disease, diet plays probably the biggest role of any treatment or management tool that I can offer. Diet is going to help to decrease the amount of work that the kidneys have to do, because the kidneys are so important for helping to get rid of waste, and most of that waste comes from protein metabolism. And that's protein that you eat, and that's also protein from muscles. So when we feed a patient with kidney disease a regular protein diet, their kidneys really struggle to get rid of those toxins. And what ends up happening is those toxins build up, the patient feels worse, and it becomes this cycle where they don't feel good, they don't want to eat or drink, they can get more dehydrated, that can harm the kidneys, and so forth. So with diet, we usually will reach for again, veterinary exclusive, low protein kidney diet, and that's going to be low in protein so that the kidneys don't have to work quite as hard. and that actually can, in some cases, slow the progression of kidney disease. The other thing about these kidney diets is they're going to be supplemented in a lot of cases with potassium. So potassium often is something that can be waste in the urine. And a lot of patients, dogs and cats that have kidney disease, in some cases they can lose enough potassium that you need to supplement. And so these diets are going to have, in some cases, some extra potassium to kind of help with that process. These diets are also going to be restricted in phosphorus. Phosphorus is another waste that the kidneys have to get rid of. And when the kidneys aren't functioning properly, we can see phosphorus start to build up in the bloodstream. So by having lower phosphorus concentrations, that's also going to help, again, decrease the amount of work that the kidneys have to do, especially when they're not working properly. When it comes to the liver, I'll utilize diets in patients that are in liver failure and also in patients that have copper storage disease. For those in liver failure, obviously the liver is really important for detoxifying the body and also getting rid of waste. In patients that have liver failure, their body really struggles to do that. Their body also has a really hard time processing ammonia, and as the ammonia builds up in their bloodstream, they can actually develop neurological signs. So liver diets are actually going to have lower protein, and in this situation, the goal of that is to decrease the amount of ammonia being formed so that these patients don't become neurologic. Liver diets are also going to be restricted in copper. So patients that have copper storage disease, where their liver is unable to get rid of copper, and that copper builds up in their liver until it reaches a certain threshold, and then as that threshold is met, all of those copper stores starts to leach out into the liver and cause a lot of inflammation and damage. Liver diet in that situation can be beneficial because if we have less copper going in, there's not going to be as much being stored. And so that would be another situation where I utilize diet for liver diseases. Liver diets are also going to be supplemented with zinc, which can also help with copper storage disease. It actually helps to compete with copper absorption, and so again, another way that those patients will store less copper. So those would probably be the two big liver conditions where I'll reach for diet. We have a lot of patients with liver diseases where diet is not part of the treatment because their liver, although it might be not functioning normally, it's still functioning well enough to get rid of waste. And so in those situations, diet is not very helpful. And so I won't reach for it in those situations. Another disease category where diet's really important is actually in patients that form bladder stones. Both cats and dogs can form stones, and there's different types. There's some that form in the face of infection. Usually those are managed with treating the infection. There's other stones that will form for no reason at all, or we don't really know why certain minerals are being excreted into the urine. And then there are some genetic diseases that cause stones to form in the bladder as well. There are different urinary diets that we can utilize in these patients to, again, decrease the amount of minerals that they're excreting in the urine, or again, turning on or turning off different pathways by which these minerals are going to be made and excreted in the urinary tract. So we can utilize diet in those patients once we know what the stone is, or if we have a suspicion of what the stone is. Utilizing diet to help dissolve the stone can sometimes be utilized, or in a lot of cases what we're doing with diet is trying to prevent stones from coming back once they've been addressed, either surgically, or there's other non-invasive techniques that can be used as well. So that would be another category where I utilize diet. But again, I think the most common thing that I see by far would be GI diseases, and then probably kidney diseases where diet is utilized heavily. Well, thanks for joining me again. If you have any questions, let me know. I'll see you in the next episode.